Assalamu alaikum, everyone.
I'm audible, Dr. Kamal?
Yes, you're perfectly audible.
Okay. Should we start?
Yes, we can. We can start. I have already started the recording as well.
So, this is the second session after radiology, and we thought that before going to discuss the vascular problems, it is very important to go through the basic anatomy and angiography of neurovascular system, especially the brain. So this is the start. The objective.
Uh,
Uh,
I'm so sorry for interrupting you right in the beginning. Please start the slideshow so that we all get to see it in the full screen.
Is it not visible?
No, this is visible, but you need to click the slideshow button. The projector, right by 100%, 108%. Yes, right by that side. This one.
Okay. Thank you.
Okay, I'm going to mute myself and not unmute.
I have learned a lot from you in this sense, Dr. Kamal. Thank you so much.
Okay, thank you.
So we are starting it that what we should do first and what should we do last, and what is the importance of which type of angiography. It is very important, and how we have to decide that now even either we have to go for the CT angiography, MR angiography, or catheter angiography. It is very important for us. So objectives of today's is the case, then identification and the site. Later on, we will discuss that on the basis of these three objectives, what we are going to do, what kind of angiography you are going to do. So this is the case of 54 years old male presented with a history of severe headache since last 3 days and loss of consciousness since last 12 hours. So this is the CT scan of this patient. So anyone who can interpret it, just briefly, what is
Hi,
going on?
I can try, doctor.
Sorry?
May I try? I'm Lalita here.
Yes, sure.
Okay, so this is a plain CT brain, non-contrasted of this patient, of this 54-year patient who presented with headache and severe headache for 3 days and loss of consciousness for 12 hours. So on the CT brain, we see multiple hyperdense lesion, mainly at the anterior interhemispheric, also at the bilateral sylvian fissure and the posterior interhemispheric. So otherwise, the salsa and gyri are grossly effaced. There is also appearance of hydrocephalus in this. We can appreciate the dilated third ventricles and also presence of enlarged temporal horns. So my provisional, okay. Should I give a provisional diagnosis or just interpret
It
these?
should be definitive. It should be definitive.
Okay, so my provisional diagnosis is a ruptured subarachnoid hemorrhage secondary to a probably ruptured aneurysm. Most likely, this is from the anterior circulation. It could be an ruptured ACOM aneurysm, most commonly. Yeah.
Okay, excellent. But be precise and to the point when you are going to, especially for the exam point of view where everything else, that multiple hyperdensities are there, not lesion, multiple hyperdensities are lesion at all the anterior circulation, most likely you can say, most pronounced in the at the territory of the ACOM, and then bilateral sylvian fissure with the associated dilatation of the ventricles.
Don't disturb me. I'm studying.
I think there is a mic is on, so please mute
Yeah, Dr.
yourself.
Raja's mic was on, but it's muted now.
So this is the test case. How to investigate radiologically in this patient.
So radiologically,
angiography.
sorry.
Yes.
So if we have in an emergency setting, we can go for a CT angiogram. So if we have the facilities available, we can go for a DSA. Yeah.
What about MRA? No?
MRA would not be helpful in detecting an aneurysm because of the presence of the clot over there. So an early MRA is not ideal. It's not ideal to identify the location of an aneurysm.
Excellent. So there are multiple. We have three type of angiographies, like the CTA, like the MRA, and the DSA. But very frequently we use two type of angiographies. Most likely, when you are going in the acute emergency or any kind of patient who is presented to us with a ruptured aneurysm, that is the CT and the DSA. We are going to screen the patient, the previous history of atherosclerosis, and we are suspecting some kind of stenosis and some kind of aneurysm, but it's not ruptured, then we can go for the MRA. So you are right. For the brain, it's very important that we should know that how much brain is supplied by which territory. There are two types of circulation. One is the anterior circulation and the posterior circulation. Two-third of the brain, including cerebellum and the posterior brain stem. Two-thirds of the brain is supplied by the anterior circulation, and one-third of the brain is supplied by the posterior circulation. Anterior circulation, carotid, internal carotid artery, and by means of the three main branches, and the posterior circulation that is consist of vertebrobasilar circulation. So this is the CTA. What is the indication of CTA? Ischemic stroke. We can go for the carotid artery stenosis. We can go for the subarachnoid hemorrhage. That is secondary to the aneurysms or AVM, highly vascular tumors. Uh, we thought previously, and we are thinking that angiography is only helpful for any pathological vascular structure. But nowadays, when you are suspecting some kind of, when you are seeing on the CT scan and the MRI, a very highly vascular tumor, then you can go for the angiography as well. CTA, the most likely. Why? To see the arterial supply to that vessel, and that's why, because operatively it's very important to address that vascularity earlier. So contraindications, not so that only the patient is allergic to contrast or non-compliance, then we can avoid the CT angiography. What are the advantages of CT angiography? Beside and apart from vascular structures, we can assess the brain parenchyma. It's very important if we have the hematoma, that it's very important that we can assess the brain parenchyma. Multiplanar and 3D reconstruction is there. As nowadays, we can advise the patient if we are going to the CT angiography for the vascular lesions, 3D reconstruction is very important. It gives some ideas as related as like the DSA, digital subtraction angiography. We can evaluate vessels from the origin. Suppose there is a anterior circulation, there is a ACOM, then we can address all the vessels in this one, like the internal carotid artery, MCA, and then ACOM and ACA. It's less expensive, easily available. Most of the centers which have the CT, they can do the CT angiography. 90% sensitive in the acute cases. That's why it's very usable. What are the disadvantages of CT angiography? We cannot assess a single vessel like the DSA. DSA has the quality that you can, if you want to see only the anterior cerebral artery, you cannot go for the contrast or CT angiography for only cerebral artery. You have to go for the whole brain circulation angiography. This is the drawback of CT as compared to DSA. a low resolution than DSA. That's why sometimes we miss the aneurysm. Sometimes we cannot assess the proximal, distal, and the neck as good as the DSA. And when the last drawback, beside and apart from the contrast, it also used the ionizing radiations. That is the disadvantage of CTA. So this is the CTA of a patient. This is my own patient. So he presented uh, with this. So anyone who can interpret it now? Anyone? This is CT angiography. Yes, please.
I'll try, Doctor. So
Yes.
this is a CT angiogram. On the left is the Excel card and the right is the surgical image. So we can appreciate the anterior and posterior circulation. On the left, I am able to appreciate a large circular aneurysm on the M2, M3, MCA and bilobe. It looks like a bilobe MCA aneurysm on the M2, M3 portion.
Okay. So what about this one?
Mm,
And you are saying that this is the aneurysm. Yes, you're right.
mm.
Yes, this is bilobe. Excellent. What about this one? What about this one? What about this one? Look at here.
Okay, so at the bifurcations, MCA ICA bifurcation, there appears to be a circular aneurysm. Also at the ICA could be, I don't know, maybe it's a PCOM aneurysm on the right side.
Yes, you are right. This is the case of multiple aneurysms, and this is the CT angiogram. You are very right, and you interpreted it very well.
Thank you, Doctor.
Someone is asking someone
No, I have
something.
muted them. I feel like the monitor of a class with very rowdy students that I need to keep muting again and again. Please mute yourself, everyone.
So first you have to see what are the structures, what are the vessels you can identify. Yes, it is right. Posterior circulation, not the complete posterior circulation, some part. This is the basilar artery. This is the point of basilar. What about this one?
There's the PCA.
Very good. This is the PCA.
Yeah.
And this is
There's
posterior communicating.
Yeah.
Yes. What about it?
That's the ICA.
ICA, excellent. This is MCA.
MCA.
This is anterior cerebral artery.
The A1 portion of the ACA.
A1. This will be here, will be ACOM.
Yeah.
And then A2, then further segments of anterior circulation. So this is very important. First, you have to go through the normal vascular structure anatomy, that where is going. Then it's easy for us then how we identify the site of aneurysm is. So this is the CT angiography. This is the lateral view of it, and anterior cerebral artery is very clearly visible here. I will not go into detail because in detail we have to discuss the angiogram. So this is the good quality of CT angiography and advantage, but drawback what? If I want to see only this MCA on CTA, that is not possible. That's why we prefer in this regard the DSA. So MRA, second is the MRA. So what is the MRA indications? Anyone?
I think the MRA indication would be when we are not able to assess an aneurysm. I mean, if a DSA is a negative DSA or a CTA is a negative DSA, and we want to further assess once the clot has resolved, then there is a value for a MRA, or to see if there's any other vessel abnormalities that we'd like to assess. I think
You are very good, Zabardast. You are very good in radiology and angiography. I think you have previously done some classes of radiology. Okay, good.
this might
MRA.
be subject, doctor.
Oh, MRA to some extent has the same indication like the CTA, but it has some superiority on CTA in different aspects. Like you said that when the DSA and CTA is negative, when the DSA and CTA will be negative, especially when we are suspecting some kind of atherosclerosis, some kind of a small tiny unruptured aneurysm, because CTA can appreciate the aneurysm more than 3 mm, because less than 3 mm aneurysm cannot be appreciated most of the time on CTA because of the low resolution. So on this way, MRI has the good advantage over both of them. So what are the contraindication of MRA? I didn't write here the contraindications and indications because the contraindication of MRA are same as that of MRI. MRI. That's why there's no need to go into detail the contraindications. Like the metallic metals are there, ferromagnetic clips are there, different things are there. So we cannot go for the MRI angiography. If the same contraindication points are there in like the MRI, so we will avoid it. So this is MR angiography. I prefer MR angiography in a sense only just to read the normal vasculature and just to see the vascularity, because it gives some very excellent pictures of the angiography. So anyone who can interpret of the first figure of MR angio on the left side. Okay, I tried. It's same like CT, but it has good imaging. You can see here. Look at here. This is basilar. This is posterior circulation, basilar, and this is PCA. What about this one?
SCA.
See, and what about this? This one? This is what about this one? This one.
Superior cerebral artery.
Superior cerebral. This is not PCOM. This is superior cerebral artery. And what about these two?
Vertebral artery.
Vertebral artery.
Sorry?
Vertebral artery, I think.
Vertebral artery.
It must
Sorry?
be pica.
This is not vertebral artery. This is, yes, someone said it's a pica.
Yeah.
Yeah, yes, right. So what about this one? This is internal carotid artery.
Yeah.
And this tiny hair, this is posterior communicating artery. This is same internal carotid. This is MCA. This is anterior cerebral artery. And this is ACOM. So this is the total angiogram, MR angiogram, nothing else. So this is the sagittal section. Anyone just tell me that what are the main arteries visible here on the sagittal one, lateral view?
On the
Anyone?
sagittal view, we can see the ICA segments as well as the anterior and posterior circulation.
And what is this? Which artery? This one?
That is the
one.
that is the ACA.
And what about this one artery? This one?
That's the A2.
How? Anterior communicating? No, anterior communicating will be here, not here.
The distal
Anyway.
the distal ACA, is it?
Precallosal.
So is this the same artery, one artery only? This one and this one?
Yeah, bilateral.
Which side, right or left?
Not sure, doctor.
These are right and left both. Sometimes angiography confused you. Sometimes in exam and sometimes in angiography, they give mirror image and double image, right and left. So the surgeon and the radiologist become confused. This is a mirror image, and you can see the right and left both are visible here. Okay, so look at here. This is visible. There is a left intercanal carotid artery, and this is the left anterior cerebral artery on the above side. On the opposite side, this one you can see this is the right anterior cerebral artery. This one is the left one, and that is the right one. Two arteries, middle cerebral artery, and these two arteries. What kind of these two vessels? Yes, please.
It's a PCA, I think.
PCA, excellent. Right and left PCA, posterior cerebral artery, and this is basilar artery. So this is the right and left both. Sometimes angiography is confusing. That's why you have to be careful about it when such kind of images are there. You have to be first think that how it is correlated. Look, right and left, right and left, right and left. Later on angiogram, we'll see that how it is there. So the last one, the catheter angiography, we will give some time to it, and it is very important that how to read the digital subtraction angiography.
Dr. Etizaz, your voice is dropping off in between. You need to be closer to whatever mic you're using.
Now it's clear?
Yeah, it's better.
Now, okay. So it's very important to see the DSA. DSA, how to read. First thing, there are three main important things are in the DSA. First, we have to know that what is the side. It is the left side or right side. Second, what is the view of this angiogram? It is the AP view, it is a lateral view, it's an oblique view. And third thing important that what kind of injections has been given. When you will go for the aneurysm, then we will understand that what's the importance of these kind of injections. But when angiography is in front of us, DSA, we can see that what kind of injections we can see. The CCA, common carotid artery, it is the ICA, internal carotid artery injection, it is the ECA, external carotid artery, it is the VA, vertebral or the basilar artery. Injections are very important. Routinely, we go for the four vessel angiogram, when we are showing the intracranial vascular pathology. Two internal carotid arteries and two vertebral arteries. This is called the four vessel angiogram. Sometimes we go for the six vessel angiogram. So what are the six vessel angiogram? Anyone?
Two vertebral arteries, sir. Two vertebral arteries.
Sorry?
Two vertebral arteries.
Two vertebral arteries and two internal carotid arteries. This is the four vessel angiogram. What is six vessel angiogram?
With the external carotid artery.
Excellent. What is the bilateral external carotid arteries? If we are suspecting some lesions outside of the cranium, external carotid artery territory, we go for the six vessel angiogram. Routinely, we go for the four vessel angiogram, but if we are suspecting, then six vessel angiogram. So someone can identify that what kind of injection is given here. It's a CCA, it's a ICA, it's a ECA, it's a VA or BA. Anyone?
ICA injection, ICA run.
ICA, how ICA?
Because we can see the 90-degree pattern of the ICA curves. So I think
Yes, please.
we can see the carotid siphons. We can appreciate the carotid siphons.
Mhm.
And then we can see the anterior. I don't know. I think we are able to appreciate the carotid siphons as well as the ACA and the MCA here.
Okay. Anyone else? Good. Good. Anyone? Any other
Yes.
person?
In addition to that, we cannot appreciate the common carotid artery. So we can't appreciate the bifurcation of the common carotid artery. So
it's which injection? CCA, internal carotid, external carotid, common carotid,
internal carotid.
internal carotid. Okay, good. Any other person?
Sir, it seems like the portions of the internal carotid arteries can be assumed like cervical, petrous, lacerum, and then the clinoidal ring is also visible,
Yes,
and
Mustafa.
then bifurcation of the ACA and MCA.
So what you think? What you think? It's the ICA?
ICA, sir.
Okay. Good, but it's not ICA. Because maybe you think that you have some wrong perception of injection. Remember one thing, when injection means when you are injecting a contrast, everything to these all vessels, above that vascularity will be identified and you can appreciate. So here, see here, what kind of vascular structures are visible here? Which territory? Not only internal carotid. Look at here. This, you are right, this is internal carotid artery. These are all segments. Okay, but what about this vascularity? What about this one? Why then it is visible if only the internal carotid artery injection has been given? Because I told that in the DSA, it has the quality that when you give the injection to any vessel, only that will be visualized to you. If it is the internal carotid, why the associated external carotid artery structures are visualized here? So it means it is not the internal carotid. If it is not the internal carotid, external carotid artery vascular and the branches are also visible, then what injection it is? Yes, please.
CCA.
Excellent. It is a CCA. So it is a CCA injection because the external carotid and internal carotid both are visualized. So it is not only the internal carotid. Got it?
Yes.
So external carotid, this is internal carotid. Then you said that siphon, then NCA, then anterior cerebral artery. This is very important that we should know that what kind of injection it is. So now it is clear. So we are going through first the IC, internal carotid artery angiogram. So anyone who can tell the part of that how many part of segments of the internal carotid artery, please? Yes, please.
Yes. That is cervical part,
Hmm.
the petrous part,
Citrus part,
the laceral part,
lacerum part,
the cavernous part,
cavernous part,
the clinoidal part,
hmm,
the supraclinoidal or the ophthalmic artery part. Then we
hmm.
have the branching part and the terminal part, the terminal
So we all are
branches.
communicating. Excellent. There are 7 parts of this one. This is the cervical part, or you can say the vertebral hair. Then from here to here, this is the petrous part, that's the second part. This is the lacerum part, then third part. from here to here. Lacerum part is very short from here. Then you can say the cavernous part. Look at here, this hole is the cavernous part. Then you can see this one cavernous. Then it is a glenoidal part. This hill, this short. Then it is from here to here. It is ophthalmic part. Then this is communicating. So which kind of injection is given here? Yes, please.
ICA.
Sorry?
The ICA.
ICA injection. So in ICA injection, vertebral part of the ICA, can it give to the any branch, internal carotid artery?
The PCOM.
This is PCOM.
No.
If it is cervical part or the vertebral part, can ICA give any branch from the
No, sir.
vertebral part?
No, sir. No, sir.
The answer is no. Yes, Mustafa, good. Then which kind of a branch this one is? It means it is not a internal carotid artery injection only. This is from the branch of the external carotid artery. So again, it is a CCA, common carotid artery injection. Remember, look at here. This is the vertebral part. Vertebral part can never give the branches. These are different branches of this. This is superior thyroid artery. So how it is possible that this can give a branch? So it means it is not a ICA injection, it is common carotid injection. So you have to be careful regarding it by going through it, because first identification is the type of injection. Otherwise, it will be very difficult sometimes for you to go through the angiogram. Okay. So this is the centrality. Look at here. What is the site of this one? It is the right side or left side? Second thing is the right side. What is side? It is a right side or left side? Internal carotid artery. Yes, please. Anyone? It is right side or left side?
It is presumed to be left.
Why it is left, Mustafa?
Because it is more prominent as compared to the ECA.
Then why it cannot be right internal carotid?
Yes, sir.
Okay, you are right. Good. It is a left internal carotid artery. I am giving you a very easy method that how to identify it is a right or left. So look at these convolutions and these ones. Okay, this is the planoid part, and this is lacerum, and from here, this part, when it is on left side, it is on the left side. It is the left-sided territory. So look at here. These both coordinates on the left side, so it will be on the left side. So this is the left internal carotid artery.
I
So
want
what is
to make a very brief interruption because there was this cheat sheet that I used during my exam. Wherever the MCA is going, it's injection of that side.
sorry?
Wherever the MCA is going, it's usually the injection of that side. If MCA is
So
visible. So
this
if
is
MC,
MCA.
yes, so MCA is pointing to the left.
MCA is pointing to the right side.
Okay, you got me there. Let me think. Let me think.
This is the sagittal view. This lateral
Okay.
view of the internal carotid artery.
Uh-huh.
There's big difference between the lateral view and the AP view. In the lateral view, what happens? This is the pitras part. This is the pitras part. Pitras part is little bit anterior and above. But what happens when you are going the AP view? It will be totally on the right side. When the pitras part is totally on the right side, tilted, and this clinoid on the left, then it is left-sided because this pitras is opposite to this one. Okay, and this is not the accurate one because in the next image we are seeing that is which side. So you have to see these two. It will be easy for you because this MC on the right, but this is the left internal carotid artery.
Your voice is dropping again. Somebody wrote in the chat box as well. I think when you move away from your laptop, your voice drops.
Okay, now it's clear?
Yeah, it's better.
Okay. So now please, this is which side? This is the lateral view. First one we have discussed. Both other views, which side? Look at here now, Dr. Kamal. This is the pitras part.
Right.
This is the clinoid part. Am I right? So the pitras part on the right side and the clinoid on the left. In the AP view, it is opposite. Look at here. This is AP view of the left-sided internal carotid artery. And what about it? Anyone? What about this one? It is a left or right? Yes, please.
I think right. I think it's the
Right.
right.
It is a right-sided internal carotid artery. So we have done the injection. We have done so we have gone through the injection, that which kind of injection it is a CCA, IC, and the ECA. We have seen that what is the side of this one, and the next one. Second is the middle cerebral artery. So this is the diagram. We will see that how it is correlated to the angiogram. It has about the 4 segments, M1, M2, M3, and M4. The M1 is the basal segment. This is M2, then M3, then M4 is the M5 is the terminal. So different branches are there. Then we have see and look that how it is correlated to this one. So this is the angiogram of middle cerebral artery. So can anyone interpret it? Yes, please. Can anyone? No? So I'm trying to interpret it. So first we will go to this one. This is very easy. This is internal carotid artery. Okay. Till that here, internal carotid artery. This is MCA hole. MCA has 4 segments. On AP view, this is AP view of this one. We can see that on the this side, medial side, this is the anterior cerebral artery. This is ACOM. Then it is anterior cerebral artery A2 segment. MC has 4 segments, and these are clearly visualized here and appreciated. First one, M1 segment, that from origin to the first branch bifurcation. Look at here. This is M1 segment. Okay. This is M1 from here to here. This is M2 segment. This is M2 segment. This is M3 segment. This is M4 segment. how we'll identify it? M1 and M4 are out. M2 and M3, these are up. Look at here. This one outside. These two are, M4 is also outside, going outside. Wherever these are upward, this will be M2 and M3 segment. Okay? So these are 4 segments of MCA. So it is clearly visualized here. So what are the vascularity? When we see it on the lateral side, this one, look at here. This lateral angiogram of the MCA. That's also we can see, look at here, this one. This all is them. This is here till the here, it is the internal carotid artery. From here, it is MCA. So which artery is this one? Anyone? Because in sometimes in exam, if anyone resident here, they ask, which artery is this one? Please. Yes, please.
The ACA, I think.
This one. This is not ACA. Why?
Orbitofrontal.
No.
Ophthalmic artery.
Very good. This is ophthalmic. Look at here. It is rising from the internal carotid artery. It is the ophthalmic segment. This is the clinoid segment, and this is ophthalmic segment of this internal carotid artery. It is arising from the internal carotid artery. So don't be confused with it. It is the frontopolar, or some says that it is frontopolar or different and different. But no, it is the ophthalmic artery of internal carotid. Okay, so then it will be easy for you to memorize. Anyone who can tell the branches of
Your voice is dropping again. I have no idea
anyone
why.
who can anyone who can tell the branches of, now it's clear?
Yeah, it's clear now.
Anyone who can tell the branches of MCA?
The main branches is M1 is horizontal and 2 is
These are segments.
Oh, okay. No, not sure, doctor.
Assalamu alaikum, sir. Can I try?
Yes, please.
Sir, medial and lateral lenticular striate arteries and lateral orbitofrontal artery, interior temporal, posterior temporal artery, precentral, central, and interior parietal, posterior parietal arteries, and angular arteries, sir.
Excellent. So I made it easy for you. So these are about how many branches? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There are 10 branches of most likely the middle cerebral artery. It will be easy for you. So this is which artery?
Lateral orbitofrontal.
Excellent. This is orbitofrontal. This is which artery?
Ascending frontal.
Ascending frontal or prefrontal, you can say. Excellent. This is which artery?
Interior parietal.
It is not anterior parietal. This is parietal area. This is frontal area. This is pre-central or pre-rhomboidic artery. Look at here. This is the central sulcus. Okay. This is pre-central artery. This is central artery. This is post-central artery. Or sometimes you can say it is the anterior parietal artery. This is posterior parietal artery. This is which artery? And which is the area of this one? Anyone who can tell?
That be the parietal lobe.
Sorry?
That be the inferior parietal lobe.
So which is the typical area? This is the angular artery. Okay. And what about this one? This one. Yes, please. Anyone? Someone told all the names of arteries. If you memorize, then it will be easy for you. It gives some branches to the parieto-occipital area.
Posterior temporal, sir.
Posterior temporal नीचे है, ये है. ये ऊपर वाला area है ना. This is this above. Sorry, I am talking in through. So this is above.
Angular?
Sorry?
Angular arteries.
This is angular artery. This is artery, I think I also missed it. It is some branch which supply also to the occipit. This is the temporal. This is also a temporal artery. This is posterior temporal and this is anterior temporal artery. So by this way, somehow to 80 to 90%, if you know the vascular structures and the normal anatomy, that it will be easy for us to memorize. Okay, so this is the lateral view. This is the AP view of MCA. The injection has been given. Where the injection has been given in these two vascular structures. In these two angiograms, please. Yes, please. Yes.
Sir, common carotid artery?
No, how common carotid artery?
ICL?
Yes, internal carotid artery. Which vessel of external carotid artery is visualized here? If no, remember, if no external carotid artery is here, it means it is only the internal carotid artery. If external carotid artery branches are there, it means it's a common carotid artery. If from the beginning it is being seen, that it means from the arch of the aorta you are going, perisphere trunk is visualized, but most of the time it is not visualized. Okay. So this is the anterior AP view, and this is the lateral view of this one. So anyone who can tell what is this, which side is this one, right or left? Mistakenly, it is mentioned above.
Right.
So it is right on this other side. It is the left one. Left internal carotid artery is there. Okay. So I think previously I made it. So
If you click on the annotations tab, it's going to give you the option of deleting everything all at once.
Oh, look at here. This is the anterior cerebral artery now. It's very easy. So this is which segment of M1? Sorry, I'm telling that M1. This is segment. Yes, please.
A1, sir.
A1. Very good. And this is
A2, sir.
A2. And this is
Pre-callosal, supracallosal, and post.
Very good. Very good. This is precallosal. This is pericallosal artery. Precallosal and pericallosal is different. Pericallosal is artery that is surrounding the corpus callosum. Precallosal means before the corpus callosum, and the callosum marginal, which is callosum marginal artery. What about this one? This artery. Sometimes it comes here. That is the callosum marginal. These two arteries are very important. In which approach?
Anterior interhemispheric transcallosal approach.
Sorry?
Is important in the anterior interhemispheric
transcallosal approach. Why it is important?
It is important because the callosotomy is made between the two precallosal arteries. So it's very important for you to be able to identify the precallosal artery to avoid injury to the cingulate gyrus. So it's very important to
Sorry?
identify the two
Yes,
precallosal
angular
arteries.
gyrus. Very good. To differentiate between the angular gyrus and the corpus callosum, it is very important. So look at the angiogram now of the anterior cerebral artery. It is very easily and in a good way it is correlated. Look at the previous slide, that how beautifully it is going and giving branches and going curved around the corpus callosum, giving different branches. When you see the angiogram, it is quite easy. Easily we can appreciate it. Look at here. So this is M1 segment. This is M2 segment. This is pericallosal. This is the
Your voice is
pancallosal.
again very unclear. I think it's the internet on your side or maybe
Now
something
it's
else.
clear.
Yeah, it's better, but it's breaking.
Okay. And this is callosum-marginal artery. How beautifully you can see it is appreciated here. The angiogram of anterior cerebral artery. No need to go into the detail. Now, different branches are visualized here, like the middle frontal artery, posterior callosal artery, that is superior parietal artery, that is inferior parietal artery. These are the different branches: anterior frontal artery, frontopolar artery, orbitofrontal artery. These are the different branches of anterior cerebral artery which it gives. When you correlate the normal anatomy, it will be easy for you that to go to read the angiogram. When we see this one, look at here, this is the segment, this is A1 segment, that is called the pericommunicating. This is anterior communicating area. This is post communicating from ACOM to point branch of callosum marginal artery. Yes, this is the point branch of callosum marginal artery. So it's 2. This is A3, the precallosal. Then this is the A4, and then A5, the terminal branches that correlate. So in this way, you correlate it very easily when you are going through this one angiogram. Any question regarding it? Which side is this one? Can anyone please tell? On the left side, angiogram, anterior cerebral artery, that is lateral view. Which side is this one?
That's the left side.
Left side. And what about this one?
This one is that's the right.
This is right side. Excellent. Who is there?
Hello. Yes, Kinsley.
Who is there? Who is saying it is right?
Hello. That side,
Yes.
the one you are pointing now is right.
Yes, it is right side. Excellent. I am saying excellent. So very appreciated. Oh. So what happened? So I think I missed it.
Is there any problem?
Yes. Now okay?
We do not see anything on your screen. Yeah, that's okay now. If we just have to move on the slideshow again.
Okay.
Yeah.
It's
okay.
visible?
Yeah, it's visible.
Okay.
We also
So
need to rush. It's almost 9 p.m. and it's also taking time away from your clinic as well. Everyone, he's doing these sessions from the clinic, cutting out
I am
his
going
time
to
and
end.
making
I am
some
going to
patients
end.
wait.
Yes, I am going to end it. So someone was saying that it is the left side on the left, internal carotid artery on the right side on the right. Excellent. I am very happy to see that they are getting it. Excellent. So this test case. So which side is this one? And what is the view? First, tell me injection. It is which injection? It is CCA, it is ICA, it is VA, it is BA, it is external carotid artery. Which one? Yes, please.
It's the CCA.
Yeah.
It is CCA. Excellent. It's CCA because external carotid artery is visible. On the left side, it is which view? It is lateral view, it is AP view, or oblique view? On the left side, the first one.
I think it's oblique.
It's oblique.
Yeah.
I think it's AP.
It is AP view. Look at here. This is internal carotid artery. This is petrous part on the left side. This is clinoid on the left side. Petrous part on the right side, clinoid on the left side. This is ACA. This is ACA. This is MCA. So this is coronal cut. In coronal view sense, you can say this is the AP. This is the AP view. It's not oblique. Oblique will be a little bit tilted. Okay. So this is the AP view. So it is which side? View has been done, it is AP view, good. Injection has been done, it is a CCA. Now it's which side? Is it right side or left side?
Left, I think.
Definitively you have to know. It is a left side.
Yeah, left.
So now what about this one? It is which injection?
Is the CCA,
CCA, excellent. It is which view?
the lateral view?
Lateral view, excellent. It is which is lateral view, and it's which side?
Left side.
Excellent. Very good.
Thank you.
People are getting it now. So this is the test case. Who will tell the definitive and the pinpoint diagnosis? It's which angiogram? Is MRA? Is DSA? It is CTA. And then what is the problem with patient?
MRV, I think.
Sorry?
MRV. So,
Sure.
there is
Dr. Kamal, are you there?
Yes, I am here.
You remember this patient?
Yes, I do.
Okay, thank
Somebody
you.
has already written the answer in the comments. So,
Okay. So, excellent. It's a vein of Galen malformation. So this is not a this is a venogram. So you are right. It is that someone says that is the venous angiography. So this is the vein of Galen malformation. So it's the end of this today's session. I tried my best to do on time because I already shorted this presentation that I will do only the anterior circulation because I'm not good in to manage the time. But again, uh, I could not. So this is the end of today's session. Any question, then it is welcome. So you can ask at the group. So I will try my best to answer that one. So posterior circulation we will cover in the inshallah the next session with the vascular malformations and aneurysms. So
I
thank you
have a
so much.
question like how to tell about the view. It's AP, lateral. I'm not getting it. Kindly repeat this.
This is look at here. It is the anterior cerebral artery. It is very easy to get. because when we see anatomy, the anatomy, normal anatomy in the brain, look at here. It is the anterior cerebral artery will be in the midline, the anterior side. Look at here. Look, can you memorize it? This is the coronal view. The MCA is on the lateral side, left side, or the right side, and the internal carotid will be on the side that is from here. Then it will be easy for you. But what happens when you see it is not on the midline? When you see this hole is the this is a digital subtraction angiogram. It means it is subtracting whole the bone and parenchyma. Only visualize the vessels. Look at here. This is coronal view. If I'll say make it, this is coronal view. Coronal means epi view, and this is sagittal view. It will be very easy. You have to correlate this normality, then it will be easy. Got it?
Yes, thank you.
Yes, please. Anyone? So I think we should end and be ready for the next session. We will cover the posterior circulation and then the aneurysms. Thank you.
Everyone, if you have any questions regarding today's session, you can leave it on the WhatsApp group, and we are going to cover it in the next session, inshallah. Thank you, Dr. Etizaz. Thank you so much for taking out the time from your clinic time, which is very, very difficult
Thanks to
on
you.
any
And
consultant.
again, I could not complete on time because I
That's okay.
already make it small. But inshallah, next time I will try.
Yeah,
So thank you
we'll
so much.
see
Thank you,
about
Dr.
that.
Kamal, and
Thank
thanks
you.
everyone.
Okay, thank you,
Thanks.
everyone. This is a wrap for today.
Thank you very much, Sama.
Thank you, doctor.
And Dr. Lalita, I don't know if you're still here with us, but you were beautiful today, like absolutely beautiful.
Thank you, doctor. Thank you.
Okay, everyone, this is a wrap.
Good night.
Good night.